Hi, this is Innovation Project Video Proposal by Gospel Okoye. Problems the innovation will solve. The innovation project aims to reduce the risk of coronary artery disease, CAD, in African Americans by incorporating mobile application technology to facilitate dietary and lifestyle modifications to lower their LDL cholesterol. Coronary artery disease is a primary global health concern and the leading cause of death in the United States. African Americans are significantly at a higher risk of developing CAD due to genetic, environmental, and lifestyle factors. Mensa 2018. Studies have shown that African Americans have a higher prevalence of hypertension, diabetes, and obesity, all risk factors for CAD. Additionally, they are more likely to have a higher LDL cholesterol level, significantly contributing to CAD. The disease is prevalent in African Americans, particularly those with a family history of CAD and those with unhealthy lifestyle habits such as high-fat food, lack of physical exercise, and smoking. The consequences of CAD can be severe and include heart attack, stroke, and even death. If the problem were solved, there would be a significant reduction in the incidence of CAD in African Americans, and the associated health outcomes would be significantly improved. Duffy et al. 2010. Mobile application technology will provide a practical solution to encourage individuals to adopt healthy lifestyles and manage their risk factors effectively. By providing real-time feedback, support, and education, individuals can make informed decisions about their health and take action to lower their LDL cholesterol levels, ultimately reducing their risk of CAD. Implementing innovative projects can improve the African American population's health outcome and quality of life. Background of problem, significance of problem. Coronary artery disease, CAD, is a significant health problem affecting millions globally. In the United States, CAD is the leading cause of death in men and women, responsible for 1 in every 4 deaths. African Americans have a higher prevalence of CAD and its risk factors, including hypertension, diabetes, and high LDL cholesterol, than other racial and ethnic groups. According to the American Heart Association, African Americans have a 30% higher death rate from heart disease than non-Hispanic whites. Sao et al. 2022. This health disparity affects individuals and has social, ethical, and financial costs for families, communities, and healthcare systems. Proera and Proera 2020 asserts that social costs of CAD include decreased quality of life, disability, and emotional burden on individuals and their families. In addition, the ethical prices include issues related to health and equity and access to health care for African Americans. Lastly, the financial costs associated with CAD include healthcare expenses, lost productivity, and economic burden on families and society. Background of the problem. LDL cholesterol is a significant risk factor for CAD. African Americans have a higher prevalence of high LDL cholesterol than other racial and ethnic groups, likely due to genetic and environmental factors. Mensa 2018. Professional literature about problem. Research studies have explored various interventions to reduce the risk of CAD in African Americans, including lifestyle modifications and medication therapy. Lifestyle modifications such as dietary changes and physical activity have improved lipid profiles and decreased the risk of CAD in African Americans. However, there are several barriers to adopting and maintaining these lifestyle modifications, such as lack of access to healthy foods and safe exercise spaces, cultural preferences, and competing priorities. Amir and Kuda, 2022. Cruz Ramos et al. 2022 established that mobile health technology, such as mobile application apps, has the potential to overcome some of these barriers by providing tailored interventions that are accessible, convenient, and culturally appropriate. Several mobile health interventions targeting CAD risk factors, including LDL cholesterol, have been developed and tested in diverse populations. These interventions have shown promising results in improving lipid profiles and promoting healthy lifestyle behaviors. Ineffectiveness of past solutions. The traditional approach to managing high LDL cholesterol, including medication therapy, effectively reduces LDL cholesterol levels. However, African Americans have been shown to have low adherence to medication therapy, which limits the effectiveness of this approach. Lifestyle modifications have also been shown to be effective in improving lipid profiles, but there are several barriers to adoption and maintenance, as mentioned earlier. Past interventions not incorporating mobile technology may have failed to address these barriers adequately. Da Ananian et al. 2018 also note that lack of cultural relevance and accessibility may have also contributed to the ineffectiveness of some interventions. Incorporating mobile technology, including mobile apps, may address some of these limitations by providing tailored interventions that are convenient, accessible, and culturally appropriate. Innovative collaboration. For the project, collaborations were made with a cardiologist, a chief nursing officer, and a patient advocate. The cardiologist was selected due to their in-depth knowledge of heart health and understanding of the risk factors, the risks and obstacles related to coronary artery disease among African Americans. They can provide reliable information and evaluate technology's effectiveness in addressing these risks and enhancing patient outcomes. The chief nursing officer was also chosen because nurses have first-hand experience caring for patients with the disease and can offer valuable insights into the difficulties patients and their families encounter. CNOs can also assess the practicability of using the technology in a clinical environment and provide input on its potential impact on patient outcomes. Finally, the researcher opted for the patient advocate who has personal experience with the effects of coronary artery disease. Their direct experience with the disease enables them to provide crucial information about patients and their families' experiences and viewpoints. Additionally, they can help evaluate the technology's potential impact on patient outcomes and quality of life. The cardiologist thinks mobile information technology is important in heart health evidence-based practice, and can make a significant difference in reducing the risk of coronary artery disease in African Americans by enabling patients to be more involved in their care. Nonetheless, technical obstacles such as security, data privacy, and interoperability need to be addressed. The cardiologist suggested utilizing resources such as the American College of Cardiology, American Heart Association, and National Heart, Lung, and Blood Institute to help create a proposal for an innovative project. According to the patient advocate, mobile technology can be a beneficial tool for managing heart health and decreasing the chances of coronary artery disease in African Americans. They believe that technology can provide patients with more control and better care quality. Nevertheless, there are concerns about privacy and discrimination, which are ethical and social issues. To address these issues, the patient advocate suggested collaborating with patient advocacy organizations and conducting focus groups or surveys to obtain further feedback. The CNO acknowledges the possible benefits of mobile technology in enhancing healthcare and lowering the chances of coronary artery disease among African Americans. The CNO also stressed the significance of addressing technical concerns while utilizing mobile technology in healthcare, including precision of data obtained from and given to patients. Additionally, the CNO proposes exploring funding prospects through entities like the National Institute foundations. Utilization of appropriate technology, cardiovisual. Cardiovisual is the mobile application that was proposed to address this problem. This app will help users assess their risk for coronary artery disease by using a combination of user-entered information such as age, sex, and medical history, and lifestyle habits to calculate a user's risk score. Cardiovisual is a mobile application designed to educate individuals about heart health disease, risk factors, and how to lower their risk. It provides users with visual aids, such as videos and animations, to help them understand the disease process and how lifestyle changes can make a difference. The app is user-friendly. Users can easily input their information and get personalized risk score. The app is also easy to navigate with clear and concise recommendations. One of the benefits of cardiovisual is that it addresses the risk of coronary artery disease in African Americans by increasing awareness and educating users about the factors contributing to this disease. The app's ability to provide users with risk scores and personalized recommendations could motivate individuals to make lifestyle changes to reduce risk. For example, the app may suggest healthier dietary choices, physical activity, and regular checkups with a healthcare provider. By making it easy for African Americans to understand and monitor their risk for coronary artery disease, cardiovisual has the potential to improve health outcomes and reduce the burden of this disease in this segment of the population. By incorporating mobile application technology, my project can help reduce the risk of coronary artery disease in African Americans and promote evidence-based practice. Innovative solutions. The proposed solution is innovative because it leverages emerging mobile information technologies to address the problem of coronary artery disease in African Americans. The project's innovative features include using the mobile application CardioVisual. It helps users assess their risk for coronary artery disease by using a combination of user-entered information such as age, sex, medical history, and lifestyle habits to calculate a user's risk factors. The app has several innovative features that make it stand out. For instance, the personalized recommendations given by the app based on the user's risk factors, risk score, can motivate individuals to make lifestyle changes that can reduce their risk of coronary artery disease. Additionally, the app uses an interactive interface to present the user's risk score and recommendations in an easy-to-understand format. The principles of innovation discussed in textbooks, course readings, and literature that I have collected include the use of technology to improve healthcare outcomes, the need for personalized solution, the personalized healthcare solutions, and the importance of evidence-based practice. This project embodies these principles by using mobile application technology to provide customized solutions to reduce the risk of coronary artery disease in African Americans based on evidence-based practice. Furthermore, the project is innovative because it addresses a specific problem affecting a particular population group. African Americans are known to be at a higher risk of coronary artery disease, and the use of CardioVisual can help improve health outcomes and reduce the burden of this disease in this segment of the population. The mobile application makes it easier for users to monitor their risk for coronary artery disease and can also be integrated with other healthcare services to provide comprehensive approach to managing this disease. References. That ends my video proposal. Thank you.